My presentation is on compassion training in the operating room. It's for employees within that arena, so surgeons, nurses, surgical technologists, anesthesiologists, patient care assistants, anyone involved in the process of working in the operating room. Once a week, we have a 1 hour touch base meeting in the morning that involves the whole department, where we're basically just all getting on the same page. If there's any issues, if there's some incident that occurred that needs clarification, any policy changes, just a way to address the issues of the past week. And it's not uncommon in this meeting to have a small section dedicated to mental health research or just issues that we're having and ways we can help solve those. So I think that meeting would be a good place to implement mindfulness training. I would be using the language from the Gilbert book for the most part, because the Gilbert book does a good job of explaining how like the actual breathing techniques work, and like the focusing on a compassionate person and receiving compassion from them, and then for yourself and for someone else, someone you're indifferent towards, someone you dislike. He does a good job of doing that without invoking religion, but it's generalized enough that you could use a religious figure for some of this if you wanted. So I feel like using Gilbert's techniques would do a good job of reaching out to everyone, not making anyone feel alienated by the practice. But I would just go over the basics of, sitting, breathing, following your breath as a thought enters your head, not judging that thought, but allowing it just to float away like a balloon, just having an awareness of that thought. And then I would mention the training of self-compassion and saying like, may I be happy, may I be free of suffering. I would also include may I be well rested, because as healthcare employees, we're often getting called in like the middle of the night to do things, and I think a lack of sleep is something that plagues everyone in the department at some point. But I would also include a pamphlet that contains the techniques and the phrases, because I don't think one meeting is enough, and it's something that you need to come back to. But I would also want to include Lojong phrases located in different areas of the department, to help people implement this practice and be aware of it during the day while you're working, rather than just taking this practice home, sitting, doing it, and then not, and then like losing that practice once you go out into the actual workflow. I would not mention the origins of the Lojong phrases. I don't think it would, having it come from Tibetan Buddhism, I don't think that would fly in a department like this. So I would be careful about the phrases that I do choose. This idea of having like inspirational quotes on the walls is something that it already exists at the hospital. I've got a demonstration. Here's like a quote from Steve Jobs about following your heart and your intuition. And similarly, here's a sign that talks about encouraging other people, and it even says take a deep breath. But the issue with these signs in the department is that their colors are very muted. Like it's blue and off-white and gray. so it blends into the background. You look at it once and then you never think about it again. So the Lojong phrases that I would use would probably be neon green and pink, and then maybe another set would be orange and burgundy, something like that. But I would want them rotated out so that they're different colors would be, eye-catching. But as far as like the actual Lojong phrases that I would use from the Norman Fischer book, some of them are universal, and I think they would work well. Just talking about like the first one that mentions the rarity of human life. I think that would be inspiring and applicable. But for example, some of the stuff that relies heavily on Buddhist philosophy to make sense, like give up all hope for results, I would not have that on the wall. I would want there to be an ability for people to gain access to these things if they so choose, but those are not things like give up all hope. That's not something I think I would want on the wall of like a children's hospital. But having the phrases on the walls in the department, like I said earlier, that would allow people to come back to that point and take it into the operating room. Take that mentality of like the breathing that you've learned from the Gilbert techniques into the actual work environment. So once the patient comes into the actual operating room, there's a good window for the practice of giving and receiving compassion and the Tonglen technique, because the patient will come through these doors, they'll be in a bed, and then they will come up right beside this operating room table bed. And then there will be a period where they're sitting there, they're probably in pain, although like the anesthesiologist likely gave them something for the pain, but they're suffering maybe from a broken arm, appendicitis, they're in discomfort. And as like the surgical tech, I will not be able to touch that patient at this time because I'm wearing like a surgical gown and gloves, and I'm limited on where I can put my hands in that moment. So that is an opportunity while that person is on that bed to practice Tonglen and to take their suffering and to visualize it. And I also feel like this is a very good time to do that and to get into that mindset because it's right before the surgery actually happens. And similar to the Lojong phrases that I would want outside of the operating rooms, like in the hallways, just things that you're passing every day. Within the operating room, I would also want there to be a Lojong sign. There's one Lojong phrase that's don't respond personally to critical remarks. And a lot of times in the operating room, it could be a very stressful environment. Maybe somebody is bleeding uncontrollably, and the surgeon gets frustrated or angry at the other people in the room. That Lojong phrase and keeping that in your mind, I feel like would help you maintain semblance of normality and just focus on helping the person with the physical ailment, somebody that is having the surgery right then and there. A lot of times in the operating room, you get into these situations where maybe you come in on call or somebody was supposed to relieve you from your shift and they're late, and it frustrates you. And I feel like the mindfulness compassion training from like the Gilbert book, where you're saying like, may you be happy, may you be free of suffering, doing it towards yourself, doing it towards someone you like, and then doing it towards someone you're indifferent towards. Doing it towards someone that you are indifferent towards shifts the focus of the situation, like away from yourself and your own frustrations with that situation, And it helps you remember that, like, yes, this is a minor inconvenience for you to have to stay late or whatever, or come in early or something like that. But for the person that you're helping, the person that is going through this tremendous suffering of the surgery, it's the worst day of their life. So it's a minor inconvenience to you, but that perspective, I feel like, will help the situation. There's also a similar situation, like what I was talking, where the patient comes into the room and then they move to the operating room table. We as operating room employees go down to the emergency room. I'm not allowed to film in the emergency room, so I can't show that. But where the patient is coming into the room or into the emergency room, and they're less medicated, so they're suffering even more in that situation usually. That's another good opportunity for Tonglen right there, when all the doctors are around assessing the patient. Because all these processes feed into each other, like with the mindfulness breathing techniques, and then graduating to compassion training with that, to doing mindful compassion, and then making the Lojong phrases a point that you touch on randomly throughout the day. There's this cascading effect. There's it's like the confluence of rivers, where it all just like becomes easier with time, and all these associations get made, and you can become more intentional. And like with the patient coming in, that might be a moment where you're practicing Tonglen. That might be a moment where your mind is elsewhere if it's a routine surgery. But by practicing Tonglen in that situation, that brings you to your mindfulness and to your compassion training. And whenever you're just doing mindfulness, that will bring you to your compassion. It's all these interconnections and associations in your brain, and it just becomes easier and easier. So I would encourage any employee, whenever I'm doing like the Wednesday presentation, to just continue to do it, even if you don't feel like you're getting any benefit from it in the short term. The longer you do it, the more connections that are made, and the easier and more natural it becomes, until it's just like your default state. And I definitely think this is a field that it's easy to lose your compassion in healthcare, and it just becomes a job, just becomes routine. It's just patient after patient after patient, and you lose sight of like the individual that you're helping. So I think that all these practices would work very well in this environment. One more thing, there's all these different steps in the operating room, where like you're getting your surgical instruments, you're using them on the patient, and then there's soiled instruments after that. You know, they're contaminated, and you have to take them to somebody to be cleaned. And there's things you can do along the way to make it easier for that person that's cleaning those instruments. And that just goes back to like the mindfulness. Like, it's not just being mindful of like your own actions, but how your actions affect other people in the operating room cycle. Like, there's things you can do to make it easier for that person that's cleaning. There's certain sprays that you can put on the instruments that some people do, sometimes they don't do because you're in a rush. But when one has time to settle down and do things properly, that just makes it easier for everyone. And the people that are cleaning instruments are always very gracious when you do that. So like the intentionality that comes with mindfulness and compassion for your fellow coworker, not just the patient, but also like the people you're working beside, goes a long way.